official veterinarians are beekeepers' first and main interlocutors after reporting the loss of honeybee colonies or changes in the appearance of honeybee brood or adult bees. For example, in the case of changed behaviour of adult bees or sudden weakening of colonies. Namely, in all these cases, it is possible to suspect on presence of clinical signs characteristic of certain economically important honeybee diseases, especially whose reporting is regulated by applicable legal regulations. In such cases, an authorised veterinarian conducts a clinical examination of honeybee colonies, based on which he places or refutes official suspicions of a particular disease. The examiner must pay attention to the activity of adult worker bees on the flyboard, which is one of the indicators of the strength and health status of the honeybee colony and certainly forms part of the clinical examination. Then, after opening the hive, one must necessarily know the healthy or physiological appearance and arrangement of the honeybee brood in the honeycombs. Particular attention is paid to noticing the differences in the appearance of the wax caps over the mature honey from the wax caps over the honeybee brood. Namely, it is necessary to know that the caps over a healthy brood are always slightly protruding. Depending on whether it is a drone or worker brood, then they are dry, porous, and the colour of the surrounding honeycomb cells. Of course, the appearance and behaviour of adult bees on the honeycomb are also monitored. In case of any change, beekeepers can be directed to suspicions of the presence of bee brood diseases. During the examination of all frames with honeycombs in the hive, a detailed clinical examination is carried out, after which, in case of an altered appearance of brood, changed appearance or behaviour of bees, the presence of parasites and pests, and examination of the hive bottom board, suspicion of a particular disease is confirmed. After the call of the beekeeper due to the death of honeybee colonies, veterinarians must do a so-called post-mortem inspection.